not pronounce Ferenc Tracik, Chief Medical Officer at NeuroSense, who will be presenting Shifting the Paradigm, PrimeC as a Novel Therapeutic Strategy for ALS.
Thank you. You perfectly pronounced my name. Impressive. Thank you very much. So as Fernando said, my name is Ferenc Tracik. I'm a neurologist by training and the Chief Medical Officer at NeuroSense. So I'm very excited to present our development program for PrimeC, which is a combination of Ciprofloxacin and Celecoxib. Oh, 1 second. Combination strategies in neurology is, I would say, some kind of an established treatment strategy. And the AMX 0035 approval, the Amylyx drug, actually is the latest and a very good example, right? And how the combination of different compounds actually could work synergistically together. And one rationale to combine different compounds is actually to achieve a synergistic effect of the mode of actions, but you can also combine treatment or compounds in order to improve the pharmacokinetic profile, as we are doing it in Parkinson's disease by combining entacapone and levodopa. As said, PrimeC is a novel formulation of Celecoxib and Ciprofloxacin. And from literature and also preclinical work we have done at NeuroSense, we actually know that these combination or these two compounds are actually addressing different mode of actions, such as iron accumulation, neuroinflammation, RNA metabolism, and others. According to the suggested mode of action of PrimeC, we selected a specific cassette or panel of biomarkers in order to investigate the target engagement of our drug. In regards of neuroinflammation, we are investigating prostaglandin 2, TDP-43, LC3 for the impaired autophagy, catabendepsin for the lysosomal dysfunction, and ferroportin for the iron accumulation. And of course, also we are investigating or evaluating the dysregulation of microRNA. In our development program, we are using a novel technique, which are neuron-derived exosomes. As you might know, exosomes are vesicles containing RNA or proteins, which are able to penetrate the blood-brain barrier. We are doing this together with our colleagues from Neurodex, who actually established a technique which allows us to measure all these biomarkers in blood by using these NDEs, neuron-derived exosomes. And we decided to, let's say, to tackle this by a multiple step approach. First, by the way, first, we described the baseline phenomenon, actually looking whether or investigating whether all these biomarkers are actually different in ALS patients in comparison to healthy controls. We also assessed the effect of PrimeC on these key biomarkers in a proof of concept study. Based on this data, we also did an indirect control with ALS patients who are not treated with PrimeC, so it's an indirect placebo control, if you wish. And the last step is to investigate all these biomarkers in a double-blinded placebo-controlled study. Here on this slide, you can appreciate the different biomarkers we investigated in ALS patients in comparison with healthy controls. And as you can see in all these biomarkers, we saw a significant difference between ALS patients and healthy controls. Based on these findings, we actually conducted a proof of concept study in 15 patients, 12-month dosing. And we, of course, investigated or evaluated the safety and tolerability of the drug. We also looked into clinical efficacy. And as said, we also assessed all these biomarkers. Actually, what we could see in this proof of concept study was a 30% difference in forced vital capacity in comparison in an indirect manner with patients from the PROACT database. So this is a match pair control approach. So what we did, we handpicked 30 patients out of the PROACT database who were matching according to 9 different clinical criteria to our PrimeC patients in this proof of concept study. And what we have seen is a 30% difference in forced vital capacity and 18% difference in ALS-FRS. As already said, we also looked into the biomarker, and just to highlight 2 of them, TDP-43 and prostaglandin 2, we actually saw a significant decline over the course of the study, 12 months, in these patients. We also, of course, I mean, the one thing is, biomarkers, the other thing is clinical data, and we also looked into the data whether there is a correlation between lowering the level of TDP-43 and, let's say, slowing the ALS-FRS decline over 12 months. And what you can see, the more you actually lower TDP-43, the slower is the progression in ALS-FRS. So these are the data, let's say the baseline data, control versus ALS patients. These are the data I'm just was talking about in our proof of concept study. What we did additionally is to do all these biomarkers in ALS patients who were treatment-free. That means not treated with PrimeC, right? And what you can see is a significant difference between the untreated patients versus the patients treated with PrimeC. As said, this is an indirect control. Actually, a sample we were very fortunately to get from our colleagues from the MGH. So based on this data, actually, we postulate that PrimeC has, let's say, multiple mode of actions affecting the aggregation of TDP-43, affecting the recycling process in the cell, and also a positive effect on neuroinflammation. So actually a synergistic mode of action. However, we also looked into a mouse model investigating whether the combination of ciprofloxacin and Celecoxib has an impact on the pharmacokinetic profile of PrimeC. And what you can see here is that the combination of these 2 compounds are actually increasing the intracellular concentration or level of ciprofloxacin in the brain tissue of these mice. So actually, our conclusion out of all this data is that there's obviously a synergistic effect on different mode of actions and an improved PK profile by combining ciprofloxacin and Celecoxib. Based on all these data, we decided to launch a phase 2b study, a randomized prospective double-blinded placebo-controlled study in 69 patients. The double-blinded phase is designed for 6 months. We are randomizing and the patient is followed up by an open label extension phase of 12 months. In this phase 2b study, we to choose as a primary efficacy endpoint 2 of our cassette of biomarkers, which is prostaglandin 2 and TDP-43. Of course, we are also evaluating secondary as a clinical outcomes such as ALSFRS, slow vital capacity, survival, quality of life, and manual muscle testing. Since this is a classical phase 2b, we also look into adverse events on vital signs, ECG, and clinical lab evaluations. Of course, this is nothing you can do on your own. So I really want to thank, many contributors from the academy and from other companies who actually were substantial for this progress and success of our development program. So thank you very much for your attention.
Thank you for the great presentation and the update on PrimeC and your exploration of biomarkers. We have a few questions in the chat. First one, actually, I shared this question as well. Given that PrimeC, one of the PrimeC components is an antibiotic, have you looked into the effect of PrimeC on gut microbiota in relation to ALS? Is that possibly one of the synergistic effects?
Yeah, not yet, I have to say, right? So we haven't looked into that, but it's, let's say, how shall I say, it's obvious, yeah, that this is something we definitely have to investigate, definitely, yeah, but we haven't done it yet.
And we have a question about just maybe a clarification around which of these markers have been components of exosomes or direct proteins in blood? Or are they all?
Yeah, that's a very good question. All of them are actually based on exosomes. Okay. All of them. Of course, we are also doing neurofilaments in blood. Yeah.
And that leads to, at least for me, to ask a question. Have you found that there are any protocol details that matter when isolating the exosomes or storing those exosomes in terms of stability of the different components, et cetera?
So actually, since we are not doing this, let's say, on our own, we are actually outsourcing this to Neurodex. I'm not able to answer this question, but what I learned from our colleagues from Neurodex, that there are not, let's say, nothing specific issues with that.
Thank you. And then another question around the PK effect, which is interesting. So you see that increase of the Cipro in the parenchyma of the CNS. Do you have a sense of the MOA? Is that circulating, is that an effect on circulating levels, or is that a PGP substrate inhibition thing? Do you have a sense of what's driving that?
Yeah, that's actually, sorry, I forgot to mention that. So Celecoxib is actually blocking the MDR pump, so the multi-drug resistance pump, right? And that actually leads to an increase, an intracellular increase of ciprofloxacin. By the way, you know, using Celecoxib in order to block the MDR pump, right, to increase intercellular levels of drugs is actually, I wouldn't say a well-established, but a well-known strategy
It's part of the
is
Q&A.
forward.
Thank you.
Okay, I wanna
Would you,
consolidate some
I
stuff.
think we have somebody who unmuted. I think it's Amit. Could you please mute?
Oh, do you want to actually?
Thank
Did
you.
you make it?
Amit, could you please mute? Thank you. There is a question that's a broader context question, I think, in terms of the combining drugs. On the idea of potential combinations, do you have thoughts on the idea of combining drugs that have failed in previous studies and to see that might have demonstrated some promise in moving those forward into clinical development?
Absolutely. I mean, to be honest, I think this is a great question and actually also a great idea to look into all these substances who, let's say, failed, borderline, if you wish, right? And to reconsider them as a potential combination partner to another drug. Absolutely agree. And I think, there are so many studies ongoing also in other indications, such as multiple sclerosis, for instance, exactly evaluating whether all these drugs could help in a combination, right? Either by combining two compounds in order to, let's say, to leverage the synergistic mode of action or the PK profile.
Thank you very much. And with that, we'll be moving on to our next speaker. Next joining us will be Angela.